everyone. Thank you all for joining us this evening for our presentation on improving visual outcomes for your astigmatic patients. We're very excited to tell you more about how the Duet line of lenses provides a new option for your patients with astigmatism. Dr. Jim Kirchner, the Senior Vice President of Clinical and Professional Services at synergeyes, will be leading our discussion this evening. Before joining us at synergeyes, Dr. Kirchner founded and spent the majority of his career in a multi-doctor, multi-location practice in Lincoln, Nebraska. His experience as an independent eye care professional has been incredibly valuable to us at synergeyes as we work to make fitting our Duet lenses easy, predictable, and successful. Before I hand it over to Dr. Kirchner, I have just a couple of housekeeping items. First of all, I will be monitoring the questions that come in through the chat, and I will interrupt Dr. Kirchner if a question relates to the current slide. Otherwise, he will be responding to the questions at the end of the presentation. So if you'll just continue to log your questions on the chat, they will be answered. And for those of you hoping to win the iPad mini, the drawing will be done after the webinar by someone that is not related to synergeyes, and then they will notify you by email. So I will now hand it over to Dr. Kirchner to begin the presentation.
Thank you, Christina. Appreciate that. Good evening, colleagues. Thanks for joining us tonight. I hope that the next hour can be an enjoyable one for you. I'm hoping that it will be informative and interesting. We're going to talk tonight about the latest advances in dual material contact lenses. The term we used to use is hybrid. And I'm going to share with you a little bit about what's going on within synergeyes and the products that we have that can absolutely be a bonus and a value to your practice. As Christina said, the theme is correcting for astigmats, and you're going to find that the Duet line of lenses do that like none other. And we're so excited to be able to share with you our new generation of contact lenses that we call Duet. Now, tonight I'm going to start out by first telling you a little bit about synergeyes. We're a two-division company. We have a single concept, though. It's a dual material contact lens. RGP center button surrounded by a soft silicone hydrogel skirt. And you're going to see that the materials that we're using in today's lens is much different than it was in the past, and it truly is a new generation, a paradigm shift in dual material contact lens technology. Again, that RGP center is now chemically bonded to the soft skirt. So those of you that have been around as long as I have and have tried the other previous hybrid type lenses know that one of the biggest challenges is always that cracking of the soft skirt away from the RGP center. synergeyes has solved that problem. It's a chemical bond that now permanently bonds the soft material with the RGP center. It does not break. It cannot break. We've never had a single lens sent back for a breaking of that bond. So you can put that behind you. Know that problem and issue has been taken care of permanently through synergeyes' patent. Now, as far as a two-division company, we make lenses for irregular cornea for that special need patient. Of course, you're thinking about your keratoconus patient, damaged corneas, the post-surgical cornea that needs some help, diseased, irregular cornea. All of these types of corneas we have in our irregular cornea side division of synergeyes. Our clear cone lens, our KC lens, PS, our M&A lenses, some of those that you've heard of in the past. Our clear cone we're going to talk about tonight is the newest generation lens for irregular cornea. But the other division in the complete side of our company is our vision correction division for the everyday patient, something that's going to affect you day in and day out dramatically in your practice. And what we're talking about is, again, with an RGP center and a soft skirt, we're bringing that dream to the table that we've always had of having that lens that would correct astigmatism, presbyopia, high powers, low powers, whatever it is for that everyday patient. We have a lens line now that corrects that in our Duet HD and our Duet multifocal lenses. So let's talk about the Duet line of lenses. Again, the Duet HD, which is a single vision lens. You're going to see that it's made with aspheric parameters in that single vision RGP. And our Duet multifocal, which is a multifocal progressive type design of lens. But first, let me share with you the ease of fitting. And we've worked through a lot of changes over the years, and where we're at is a lens design that accommodates a fitting philosophy that makes this line of lenses, the Duet line, very, very simple to fit. We had to adjust our fitting philosophy. What I want you to think of here tonight is that it fits like a soft lens. It really does, but only after you've established the proper base curve, which you're going to see tonight is so straightforward and so simple to do. So you combine that fitting philosophy with now the methodology of being able to assess the fit based on just comfort, movement, and your over-refraction, just like you would with any other contact lens, because we want positive outcomes. Easy to fit, happy patients with long-term success. It's good for the patient and good for you. All of the design that you're going to see in the fitting philosophy does not require diagnostic fitting with fluorescein. If you have a set of Duet already and are using fluorescein, that's fine. It doesn't have to be high molecular weight. It can be regular fluorescein with the Duet line of lenses. But you're going to see through the fitting philosophy tonight that you don't even need to use fluorescein. And quite frankly, you're going to hear how you can empirically order our lenses as well, which we are seeing great, great success with. Something very critical that I want all of you to remember is that with this Duet line of lenses, even though there's two designs because of the HD single vision lens, but also the multifocal lens, both lens types are built on a singular platform. So the back surface, the fitting surface that lines with the eye, is made exactly the same way for both types of lenses. Very easy. It makes fitting very, very standard. As you can see, we have some of the parameters here: an 8.4 RGP diameter, 7.0 optic zone, and the full diameter is 14.5. We have very high DK of 130 for the RGP button and an 84 DK for the silicone hydrogel skirt. And we have UV blockers in the Duet lenses. But we'll come to some of the other specifics of the materials in just a second. If you're fitting the Duet multifocal, the optical design is a simultaneous vision, aspheric center near add zone. It's progressive in nature. There's no rings. There's no different gradation of powers. It's a continuous progressive, just like it would be in a pair of spectacle lenses. The dead center is the highest power, and it progresses out to the distance vision at the base of the multifocal add. You're going to see the design is such that there's two zone sizes, and we'll talk about that in a second. That being the small zone is more power in the center. It's more concentrated. And the large zone is power dispersed a little bit wider. The total power of each lens does not vary. The total power, therefore, of the progressive does not vary. All we're doing is in the two zone sizes widening the progressive area versus narrowing just a little bit from 2.2 millimeters total for the wider zone to 1.8 millimeters in the smaller zone. But the total power in the center is the same. So that way you don't have to think about, as that presbyope progresses over the years, of always changing the lenses because of power each year, because they have the power to begin with. So you just stay with it, and they'll do just fine as they progress into higher levels of presbyopia. Let's talk a little bit about the lens parameters. The HD comes in a base curve of 7.1 to 8.1, as well as does the multifocal, in 0.2 millimeter steps. The skirts are the same in both, They come in a flat, medium, and steep skirt. I'm going to show you how easy it is to determine what skirt to use. And the powers, as you can see, the Duet HD comes in a +6 up to a -15. The Duet Multifocal is a +5.5 to a -10. And of course, the Duet Multifocal comes in the 2 add zone sizes, small and large. Let's talk about the diagnostic fitting process. Over to the right, the little chart shows you the base curves that the RGP material comes in. Again, as I mentioned, there's 6 of those. And all you have to do is remember one thing. We're going to fit alignment fitting. And step 1 is to select the base curve, and we'll do that through alignment fitting. Alignment fitting is the key. Some of you that have used the lens of synergeyes in the past, this is going to be a little different. It's much easier and with high success rate, but we're going to show you that alignment fitting is the key. So therefore, the goal is to produce as close as possible alignment fit in relation to the flattest K. You want to create a very small, minimal plus tier lens at the maximum between the lens and the flattest K. So again, the goal is to produce as close a possible fit. You'll find that from your flattest K, you just pick the lens base curve that would match or come closest to that flattest K. That's all you have to do to select the base curve. Again, that tier lens that's created, if you never go flatter than K, which I would suggest that you don't, that little tiny tier lens that's created between the RGP back surface and the surface of the cornea itself, that flat K, is going to be a very tiny plus lens. That's the tier lens. And again, select that base curve as close as possible to the flattest K. I don't care how much corneal astigmatism you have, 1 diopter, half a diopter, 2 diopters, 6 diopters. It doesn't matter. As long as you're doing alignment fitting, you're going to see that these lenses will work, they center, they're comfortable, and very easy to fit. So that was all there was to the choosing which base curve to choose. Now we'll talk about the skirt. Along with this alignment fitting the RGP, since we're aligning nice and flush with the flattest K, we want the flattest skirt possible, which will then, in conjunction with that flat K, produce freer movement, great tear exchange in harmony with that aligned base curve of the RGP. It's very important not to fit the skirts too tight or too steep. So start if you want to, if you have a diagnostic fitting set, and you'll have that opportunity to get them if you want them. Start with a medium skirt in one eye and a flat skirt in the other. It allows for very quick comparison. If you're fitting a Duet multifocal, initially select a small zone for one eye and a large zone for the other. And that works very well because, again, it allows the binocular visual system to fully utilize both zone profiles for maximum optical effect. Remember, the 2 different zone sizes do not have different powers. It's just how it's dispersed. So if you have one on one eye and one on the other, you get the maximum benefit from both zone sizes. Eye dominance is maybe considered. It's not necessary, but if we do know the eye dominance, we would put the smaller zone on that eye, but it's not absolutely necessary. Let's talk a second about inserting the lens. If you're new, we'd like to have some instruction here on inserting the lens. We would like to have you fill the contact lens bowl solution with unpreserved saline, and go ahead and put that lens on the eye and wait for 10 minutes, up to 30 minutes. Pull the patient out of your flow and let them adjust to that lens just like you would any other kind of contact lens. And when the time is right, then you'll bring them back into your patient flow, into your exam room, and you're able to check the fit of the lens. To make it easier to insert the lenses, you are supplied with a little inserter. You can see it in the model's fingers here. That really does make it easier in the office to insert, and that's the key. Make it easy for yourself. pull the upper lid and have the patient hold their lower lid, and you just put the lens right on, and it works so easily. We do, in our instructions, have you instruct the patient how to put the lens on with their fingers. But in the office, for you and your staff, use the inserter. It's much easier. Now they're back in your chair. Now you assess the movement. Remember, the goal is to choose the flattest skirt that provides the best movement and comfort. I want you to assess the movement first. The lens movement should be at least a millimeter, just like a soft lens, at that straight ahead gaze and the upward gaze. We want good centration, and we want no wrinkling at that skirt edge. Assess the comfort. At this stage, I want you to really listen to the patient. And if you've ordered a lens empirically, the same thing goes true here when you're judging these lenses. Make sure that you listen to the patient. You ask them, are the lenses comfortable? And if they say, well, I feel them a little bit, there's a difference between just a slight awareness and something that's truly uncomfortable. If they're slightly aware of the lenses and you ask them, could you wear these to get used to them, they say, oh, sure, then definitely that's the lens skirt you want to go with. If it's unacceptable, they say, no, I can't wear these, they're just way too uncomfortable, then you'll need to adjust the skirt. So differentiate between discomfort and mild awareness. Because remember, they're going to adapt to these lenses. There's no need to try to select the skirt on the put the skirt on the opposite eye if you know which one you're going to, and if you're doing a diagnostic fitting with lenses in office. Let's talk about the over-refraction. Now we're on step 3. Utilize the over-plus refraction. Bring them down slowly. One of the biggest challenges that I see is that colleagues get too fast and too busy, and we tend to want to over-minus, especially when we're doing a multifocal over-refraction. So just be careful. Be a little slower right now. Bring them down exactly. You're working with an RGP lens. This should work very, very good. You should find a good final over-refraction. The power should never be more than a diopter, more minus, than your spherical portion of your refraction. And you ask why? It's because that you're neutralizing the little tear lens that's being created when the RGP sits against the cornea surface. If you're past a diopter more minus, then you have somehow either the K readings are off or the lens that you put on, something's off, and you're steeper than you should be. So you want to make sure that you're within that zone of a diopter or less of more minus. And actually, you can calculate it very easily. If you know how much steeper than K you end up with your lens, if you're a half a diopter steeper than K, than the flattest K, you would be neutralizing a half a diopter tear lens, so there would be an extra half a diopter in your refraction. If you were 3/4, it would be 3/4 of diopter. You know the routine. This is the check for that alignment fitting rather than using sodium fluorescein at this point. If you're with a multifocal lens, make sure that it's been on long enough and just assess the vision. Poor near vision, you may need to replace a small zone with larger zone. Poor distance vision, you may need to go to 2 small zones. You'll know that when you have the lenses on and you're doing a checkup. But this will really become more critical when you're doing your first 2-week checkup. Remember, don't forget about possible residual astigmatism. These are not toric lenses, so they are RGP sphericals, and you'll cover up all corneal astigmatism, but you will not cover up any lenticular, which would leave you with a little residual astigmatism if there is lenticular present. So always be aware of that. And now, order the lenses. You fit the lenses, you know the parameters, order them. Be sure when you order that you adjust for vertex distance if you have higher power patient. But what we would suggest, and what we're going to share with you tonight, is the opportunity to order empirically. Very simple. You call our consultation with your Ks and your RX, and your add power if you're fitting a multifocal lens. And you can see the number on screen. You hit option 2, and they will take your order for you. They'll calculate the lenses, and the first lenses then that you receive will be the lenses that a high percentage of time, that first pair is the pair that you're actually going to be able to deliver to the patient. But when you get the first empirical order in, think of the relief it is to the patient to put the lenses on and actually see and have them fit compared to a diagnostic lens which doesn't have any power in it. So empirical ordering really does work well, but use your first pair of empirical order lenses as a diagnostic day when you have that patient in, and you let them adjust and adapt, and then you do your check. At the dispensing visit, the patient may experience a little bit of sensation. Remember, we talked about that. A little sensation is fine. This is a new lens. It does have an RGP center. There is a little awareness of the lenses in the best case scenario. But that first week, that sensation goes away. I would recommend a tiered but aggressive increase in power of wearing time for the first 7 days. Start out 5-6 hours the first day and increase it 2 hours each day. Let them go ahead and adapt quickly. And insertion removal takes a little practice on their part. And it is on your part as well. Have a staff member thoroughly train the patient on insertion removal. Use recommended solutions, including a daily cleaner. We want them to digitally rub their lenses. Remember, this is an RGP center. You want them to get the lenses clean, and so we don't get a lot of buildup on them. And so that's why we're suggesting using any contact lens daily cleaner. In fact, the daily cleaners that have a little alcohol in it is great because it really gets the lenses clean. We'll talk about solutions here in a second. As you can see, ClearCare is a hydrogen peroxide system that we highly recommend. That would be our #1 recommendation, is for them to use ClearCare. Otherwise, as you can see, the Aquify, BioTrue, the other multi-purpose solutions are fine. Let's talk about the 2-week follow-up appointment. Patients should be wearing the lenses for at least 2 hours when they come in. And we all know that. It doesn't do any good to have a patient walk in and put the lenses on the exam room and then have you check them. There's a little value to it, but you'd rather have them wearing their lenses in. So encourage them to do that. Take a detailed history, carefully document the comfort and vision concerns, check all the acuities at all distances, assess the lens movement and the patient comfort. Then, after you're done with that, evaluate the cornea and the anterior ocular tissues. If there are any complaints of discomfort or problems, then pull the lenses off and use your fluorescein and check like you would with any other contact lens. But be careful. Don't fix the things that aren't broken. If the patient's happy and the lenses look great, leave it alone. These are high oxygen permeable lenses. Let's talk about troubleshooting. When you see the patient back, if they're complaining of vision, check again, make sure you're not over-minused. Remember, think about residual astigmatism. This is usually the one that catches people. If the lens isn't fitting quite right, apply soft lens principles. We want good movement. It should be perfect centration. Adjust the skirt to address comfort and movement issues. And flatten the base curve if you have a little bit of spectacle blur that they're complaining of. If you're fitting a Duet multifocal, let's talk about this a second. You start with a large zone in one eye and a small zone in the other. When you order empirically from us, that's what we'll send you. If they're having some near vision issues when you're doing your 2-week checkup, consider adding a little plus to the non-dominant eye, just a little. Or you could go 2 large zones, whichever you'd like to try. If they're having distance vision, you could try 2 small zones, but I would like to have you consider using the Duet HD single vision in the non-dominant eye. I'm sorry, in the dominant eye. We want the single vision distance correction for that distance for the dominant eye. And you'll find with the dominant eye being fit with the HD and the multifocal on the other eye, they'll have great near vision, but they'll also have wonderful distance vision. If you're having some intermediate vision problems, consider adding a little plus to that non-dominant eye. If they're still a little blurry, try 2 large zones. Remember, these are just troubleshooting hints for those if you're having some problems. Lack of movement, we want to flatten the skirt and make sure that your skirt has the flattest, or the RGP is the flattest base curve that you can go with. If there are some candidate patients that you're wanting to think about anybody with corneal astigmatism, especially if you have those over a diopter and a half, but even under a diopter and a half. So many times we leave astigmats a little non-corrected with spherical soft lenses. These lenses will give that patient extraordinary crisp distance vision. Mild amounts of corneal astigmatism, as I just meant, will just work wonderfully. High plus, high minus prescriptions, with or without astigmatism, work great with Duet HD. Emerging presbyopes, because the HD is an aspheric lens, it provides some depth of focus, so you'll find that your early and emerging presbyope actually get immense help for the close range by using just the Duet HD. It's a wonderful lens for that. And if you want to use monovision, the HD is a wonderful lens for monovision patient fitting. The Duet multifocal, again, presbyopes with corneal astigmatism, established presbyopes, soft contact lens wearers and wanting higher, clearer vision, presbyopic emmetropes, the tough ones to fit, work very well. But again, I mentioned it earlier, don't forget about modified monovision, using a Duet HD on the distance eye and a Duet multifocal on the other eye. Works very well. And there could be some challenged patients. A lot of lenticular astigmatism is a problem. High degrees of limbus to limbus astigmatism could be a problem with some flexure, but if we're doing alignment fitting, that almost all goes away. Irregular diseased corneas, of course, think about our synergeyes lenses for irregular corneas, and severe or uncontrolled dry eyes, allergies, GPC, all of these things make fitting any contact lens a challenge.
Dr. Kirchner, a question came in about against the rule astigmatism. Could you address that?
Well, against the rule, if it's corneal, still not a problem because it'll the RGP center will cover up any corneal astigmatism. But if the against the rule astigmatism is coming primarily because of lenticular, then you will have residual astigmatism. And you want to calculate that. You know, you take your total refractive astigmatism correction and compare it to what you're finding from your K readings. And if you have lenticular astigmatism that's coming through based on that calculation, then you'll know that you'll be challenged. It doesn't mean that it doesn't work against the rule or with the rule. If it's residual, certain levels, it'll work just fine. I suggest be aware and be cognizant of how much residual there may be. Then go ahead and try putting the lenses on the patient. As we all know, when we're fitting contact lenses, the ones that you think aren't going to work, they end up working great. And the ones that sometimes you think are going to be perfect candidates don't work. So I always would like to go ahead and put them on. But yes, residual astigmatism, and as we all know, against the rule, residual astigmatism would decrease the potential outcome the most. Christina, do you want to take over and tell us about some new policies that Synergeyes has?
Absolutely. Thank you. Our goal is to make it easy not only to fit Duet lenses, but to also make it easy to do business with Synergeyes. So we've recently changed our policies completely to make it easy to work with us. First of all, there is no need to return Duet lenses in order to receive credit for unsuccessful patients. So the way that it works is when you place your first order for a Duet patient, we're going to ship you 1 lens per eye. If you need to make changes to the parameters, we'll ship you an additional 1 lens per eye, and there's no charge for that lens or for the shipping. Then once the fit is complete, you simply discard all of the lenses that were not dispensed to the patient and order the second set of lenses to complete the annual supply. If for some reason your patient is not successful, simply call our customer care department and request a credit for that patient. You can just throw away all of the lenses you've ordered for that patient. There's absolutely no need to return them for credit. We've also simplified our Duet pricing structure, and all Duet lenses are now priced at a per lens price, regardless of the number of lenses you purchase. And we have a wonderful 100% satisfaction guarantee for our Duet products. Duet lenses are all fully warranted for 60 days. So if your patient is not completely satisfied, we will refund the purchase price or provide a new pair of lenses at no charge. After that warranty period ends, we have a prorated pricing structure that is based on the length of wear time, and that allows you to replace your patient's lenses if they become lost, torn, damaged. We'll get them to you at a significantly reduced price so that you can keep your patients in the lenses. We're also excited to offer generous patient rebates that we believe make Duet lenses more competitive with the soft lenses in your practice. So any patient purchasing an annual supply of lenses is eligible for a $50 mail-in rebate. And our reorder reminder program gives you a little bit of assistance in getting your Duet patients back for their annual exam in a timely manner. All your patients have to do is sign up for the program at duetcontacts.com. They'll get an email reminder when it's time to replace their lenses, and we'll also include a $50 reorder rebate that may be applied to their next annual supply of lenses. And finally, we've set up a 24/7 patient hotline to answer your patients' questions, whether they have questions about insertion, removal, lens care. It doesn't matter. Any questions related to Duet lenses, let them interrupt our dinner hour, not yours, by calling that patient hotline. And so now that we've given you all of this great information, we want you to get started. The easiest way to get started is by ordering lenses empirically. And you can either call our consultation team at the number on the screen and press option 2, or you can order those lenses empirically through our customer care department, which is option 1. All you need is your patient's Ks and Rx. And we're going to offer you a special incentive to begin fitting while this information is fresh in your mind. We'd like to offer you $50 off the Duet HD annual supply purchase if you fit a patient this week. So when you call in to place your order, just mention the promo code Duet Webinar, and you'll get $50 off an annual supply of Duet HD. And we have found that our most successful practices start out with Duet HD and really get familiar with that hybrid platform before moving into the multifocal. Any multifocal fit is going to be more difficult than a single vision fit. So it's best to get your feet wet with Duet HD and then move on to the multifocal once you're a little bit more comfortable. And so that concludes the presentation for this evening's webinar. Dr. Kirchner, can you see the questions that came in through the chat?
I certainly can. And thank you, Christina. Let me address some of these questions. Number one is, how would I compare Duet with a Biofinity or Air Optics multifocal lens? What are the benefits? Well, I can say for sure what our lens is. It's a progressive design, which makes it, number one, a very easy to fit, easy to use design. Progressive in that it starts out at the highest power in the center near ad and then progresses out to the distance vision rapidly and smoothly, which makes it very easy to fit. But a primary benefit compared to soft lens technology is that it's an RGP center button that we're working with. So again, we master and take care of corneal astigmatism in a natural phenomena with our RGP center buttons, which can't be done with a soft lens to any great degree. So that would be the biggest benefit, is our design of the ad itself, along with it being an RGP center button that they're looking through. Hope that answers that question. Somebody did ask here, how about an enzyme? That's a great question, because as we all know, when you're fitting RGP lenses, we can have a patient clean the lens as best as they can with a multi-purpose solution, add in a daily cleaner which will keep those surfaces clean, but we all know that there can be protein buildup. So yes, we would suggest, especially for those patients that you see and during their follow-up visits that you see protein buildup, have them use an enzyme tablet and enzyme products, and that will definitely help keep that surface clean. Well, Christina, that's the questions that I see. If there are no others, I thank everybody for coming on to this call tonight, and we appreciate your time and hope giving you some new and good information. And we'd love to have you use our products, as we think they're just the best thing that is in the contact lens world right now. So much.
And for those of you who would like some more information on fitting Duet lenses, you'll see a green folder at the bottom of your screen. In that folder, you'll find tonight's presentation as well as our fitting guide. And the webinar recording will be available on demand after tonight's webinar, so some additional resources for you. And thank you all for your time this evening.